So those are the three theories of aging of the face.
Yra trys veido senėjimo teorijos.
First theory is that we have a change of bony structures.
Pirmoji teorija yra ta, kad mums vyksta kaulų struktūros pakeitimai.
Then there is another theory which is talking about the changing of the ligament tension.
Kita teorija sako apie sąnarių įtempimo pokyčius.
And there is another theory that we have a change of fat component.
Ir dar yra viena teorija, kuri sako, kad yra keičiamas riebalų buvimo vieta.
So the longer I am doing aesthetic medicine, the longer I am dissecting cadavers, I believe that the main thing of the aging of the midface is the change of the bony structures.
Aš vis dėlto manau, kad labiausiai argumentuota teorija yra būtent kaulų struktūros pasikeitimo
With
teorija.
the change of the bony structures, we have a change of projection. We know that the orbit is changing from young to old, from round to oval. That's the reason why we have this lateral part of flatness and sagging here, which makes us looking tired or sad. When we are looking on the maxillary bone, that it loses projection. Then you can imagine what will happen in the midface. So when the maxillary bone goes back, automatically the soft tissue will also change. That's why I think the theory of the loss of tension of ligaments is not true.
Ta trečioji teorija dėl įtempimo, dėl sąnarių įtempimo praradimo nėra teisinga.
So I'm coming from the general surgery. When I'm looking on ligaments, that ligaments during the aging process will increase a kind of laxity. It's impossible. In traumatology there are only two possibilities. Or the ligament will disrupt, or the ligament will pull out a piece of bone and by itself it will stay stable. A ligament is a very dense and rigid structure. An elongation of a ligament is always a post-traumatic thing where you have a disruption or had a disruption of a ligament which then is healed by a scar, and that's why it loses tension. But the ligament by itself will never, I don't believe it, will never lose the tension by itself. But when we come back, and when we know that here we have the zygomatic ligament, and when we lose bony structure in the midface, where the zygomatic ligament inserts on the bone and comes to the skin, and when the bone goes back, of course, the
kai kaulas eina
ligament
atgal,
will lose tension.
jungtis praranda įtempimą.
But it's not due to the ligament, it is due to the change of the bony structure.
Tai yra ne dėl sausgyslės, o dėl kaulų struktūros pasikeitimų.
And fat, change of fat,
Ir riebalai.
one of the main things in the aging process, as it is
Kiekvienas
supposed
pagrindinių
for
senėjimo
every
procese
species
esančių dalykų
all
yra
over the world.
visame pasaulyje.
I don't believe it really.
Aš netikiu iš tikrųjų.
Why?
Kodėl?
The older we get,
Kuo senesni mes tampame, tuo
you will see also.
jūs taip pat pamatysite.
Don't worry.
Nesijaudinkit.
With the age, we gain or we have the habit to gain weight.
Mes su amžiumi esame
Yeah.
linkę
So,
priaugti svorio.
It's not that we are always losing weight when we get older. So, but when we gain weight, why should we lose volume in the
Bet kodėl
midface?
jeigu mes
Makes no
priaugame svorio,
sense.
mes neprarandame.
Fat is fat. It
neprarandame
is
volume,
changing
aukščiau.
projection. It is changing
Riebalai
projection
keičia išsidėstymą
due to the change of the bony structure.
dėl kaulų struktūros pakeitimų.
So,
Taigi,
and if we gain weight
ir jeigu mes
in
priaugame
a,
svorio,
in a more than normal way,
labiau negu įprastiniu
Yeah.
būdu,
then of course we look better.
tada mes atrodome žinoma geriau.
So why during the aging process
Taigi, kodėl per senėjimo procesą
we
mes
should look worse
turėtume atrodyti blogiau?
for the fat is going down? Makes no sense. Yeah.
Dėl to, kad
So I don't
riebalai
believe
keitų žemyn.
in this fatty theory that this is
Grįžta
the
į mano
reason
teoriją.
why we look older, that we are losing. Yes, of course, if you lose weight, you lose also volume in the
Jeigu mes
midface, and
prarandame
then
svorį, tai
of
prarandame
course you
ir
get more
riebalus.
a more pronounced nasolabial fold, you get more sagging, of course, yeah? But the other way around, I don't think
Bet
that this
aš nemanau,
reason
kad
is one of the main. So
Yes.
we lose projection of the bony structure.
plus kaulų struktūros pasikeitimai.
But anyway, with our hyaluronic acid, the fat is the location where we place normally our hyaluronic acid and where we can change these projections. So,
Taigi,
this is what everybody of us knows from
tai yra,
the
ką mes
anatomy
visi
lectures.
žinome.
We know subcutaneous fat,
Žinome,
just
subkutaniniai riebalai, podiniai riebalai.
just a big piece of butter, right?
Yra
This is
panašiai
what
kaip
we
didelis
have
sviesto
learned in
gabalas.
our university by dissecting cadavers. Quite new, 2006, under Huber and Pilsel in Graz, they
Daug naujai.
injected color in the subcutaneous tissue.
Buvo išvirkštas spalvotas tirpalas į podinį audinį
And they found that there are compartments.
ir jie atrado, kad yra tam tikros išsidėstymo
This
vietos.
we did in Salzburg with
Šitas
Kotzofana.
padarytas Salzburge
And
16 metais.
And we could reproduce this, what under Huber and Pilsel found out.
Ir mes
So,
galėjome
the
reprodukuoti.
superficial fat compartments are reproducible.
Ir kad paviršinės riebalų erdvės jos atsigamina.
So, for our work with hyaluronic acid,
Tai dėl mūsų daro su hialurono rūgštimi
there is, for example, the infraorbital superficial fat compartment.
yra, pavyzdžiui, paviršinis intraorbitalinis riebalų ląstelynas.
Some publications are talking about the superficial malar fat pit.
Kai kas kalba apie poodinį riebalų ląstelyną.
Is it important to know something about this fat?
Ar tai yra svarbu žinoti, ką nors apie tai?
More, yes. Okay.
Daugiau ar labiau taip? Daugiau ar mažiau?
Yes.
Taip.
Why?
Kodėl?
Yes, it's also always a why. Why
Okay,
we
so
need
there are
to
thousands
know
of them.
something about this compartment.
Kodėl mes turime apie tas riebalų daleles, tas riebalų išsidėstymo zonas kalbėti.
What?
To fill the injection where is no fat?
No. But we have about 30% of our patients,
Bet mes turime apie 30% mūsų pacientų.
Caucasians, yes, they perform swellings in this area. Or a skin excess, which we call the malar mounds or the festoons. And if you have patients like that, you never should inject hyaluronic acid in this area, for it will make worse. So, nasolabial fat compartment, superficial nasolabial fat compartment. Is it important to know something about this compartment? Yes or no? Yes. Why? Why? For it is the only fat compartment which does not change the volume the same way as all the others. When we gain or lose weight. So even in very skinny patients or sick patients, we can recognize this nasolabial. And we have to be careful if we over-inject only this area, we can increase the nasolabial fold.
Mes galime padidinti nazolabialinį susilenkimą.
And then we have two middle and medial cheek fat compartments.
Vidurinio ir vidinio skruostų riebalų ląstelinas.
Is it important to know something about that? Yes or no? Yes. Why?
Kodėl? O tai visada klausimas kodėl.
Why?
Kodėl?
Why?
Kodėl?
Podel. And now you have to translate why. When I say podel, I change the language as to say, why? So, why? For we have sometimes patients with a so-called hollow cheek. Mainly men.
Ypač vyrai.
Or women, when they are doing a lot of workout, like you know. So, when they are doing workout, why they lose weight here, the women? Which hormone is increasing? Testosterone. Testosterone. Okay. So, and testosterone makes a lipodystrophy. Some cases. Or we have patients with HIV during medication. The medication of the antiviral medication for HIV patients makes a lipodystrophy. So, whoever injected this area with hyaluronic acid superficial of you?
Bet kas ar yra kas nors, kas turėjo paviršinį hialurono rūgšties injekciją?
Who did it?
Iš jūsų. Arba kuris buvo atlikęs tą procedūrą?
Nobody. No.
Ne, niekas.
You don't have HIV in Lithuania, lucky you. You don't have women with workout, lucky you. You don't have men with a high testosterone level, lucky no. Poor country. So, no. So, when you would like to inject this hollow cheek with a cannula, for example, and hyaluronic acid, you can lose a lot of material. So you inject 1 ml, 2 ml, 3
Ir
ml.
injekuojama 1, 2, 3 ml.
Of course, you will have a nice result.
Ir žinoma, jūs turite gerą, gražų rezultatą.
But look,
Bet žiūrėkit,
these compartments are vertically oriented.
šie ląsteliniai yra vertikaliai orientuoti.
So it will not be really a very long-lasting.
Tai todėl nebus labai ilgai trunkantis efektas.
But due to the gravitation,
Nes dėl gravitacijos
the material will go
medžiaga
down,
susigaus apačioje.
and after a few weeks you will have a bulldog.
Ir po kelių savaičių jūs turėsite bulldogą.
So,
Taigi,
but who is telling us to do this procedure?
bet kas man liepia mums atlikti tokias procedūras?
Those are plastic surgeons.
Tai yra plastiniai chirurgai.
Why?
Plastikos chirurgai.
No,
Kodėl?
not money.
Pinigai, ne tik pinigai.
For they are coming from fat transfer.
Todėl, kad
So,
jie
when
kyla
you
iš...
put superficially fat here,
Kai padedama aplikuojama į riebalai į paviršių,
fat doesn't spread, Fat
riebalai neplinta,
does not migrate. Fat
riebalai
is
nemigruoja.
where you put the fat will be stable.
Ir kur
Right?
riebalus aplikuos,
Hyaluronic acid is spreading.
Riebalis.
And if it is heavy and you have a vertical orientated compartment, it will even move down if it is too much. So this
Thank
is
you.
coming from fat.
Taigi,
Fat
tas
has a
kyla iš
different
riebalų.
behavior. If I want to have a long life relationship,
Jeigu aš noriu turėti viso gyvenimo ryšį,
don't worry.
meilės ryšį, nesijaudinkit.
I will inject fat,
Aš iš tikrųjų
My
injekuočiau
signature-
riebalus
with fat in your cheek.
į jūsų skruostą.
W. Wolfie.
W Wolf
With fat.
su riebalais.
And you will be forever mine.
Ir jūs būsite visą amžių mano.
If I will have just a short time
O jeigu aš turėčiau
relationship,
moters tik trumpam ryšiui,
I will do the same with hyaluronic acid.
aš tą patį padarysiu su hialurono rūgštimi.
Wolfie. But you know, after a few weeks,
Ir po kelių
the
savaičių
wolfie disappears and say goodbye.
vilkas ateis ir pasakys, viso
So,
gero.
fat has a different behavior than hyaluronic acid.
Ir riebalai turi kitokią elgseną negu hialurono rūgštis.
And then we have the lateral or temporomandibular compartment.
Ir taip pat mes turime lateralinę ląstelyną.
Is it important to know something about it?
Mandibuliarinį, reiškia, žandikaulių.
Yes or no?
Taip, ar ne, ar svarbu apie tai žinoti? Kodėl?
Model? What is model?
Why?
Why? So, why?
After yes, always next question is why?
Whoever injected here in this
Ar
area,
yra kas nors daręs injekcijas toje zonoje, kuris rodo?
who did it? With a needle? Of
Su
you?
adata, kaip?
You are not doing it?
Jūs nedarote?
Here? You
Čia?
did it?
Jūs darėte ją?
With a cannula?
Ir su kaniulė ir be.
What is it?
Also without cannula.
Without cannula? With needle? Here, superficial? Dangerous, huh? Good. Okay, with cannula.
Su kaniulė.
When you go, yeah, just cannula. When you go with the cannula here, this way, how is it?
Na ir kaip?
How does it feel like?
Kaip pojūtis?
Easy?
Lengva?
No, it's not easy.
Ne, nelengva.
It makes, right? Why? For it is a fibrotic area. So between the fascia of the parotid masseteric fascia and the skin, there are very dense fibrotic tissues. Yeah? And there is only low fat. There is not a lot of fat. So when you go here with your cannula,
Taigi kaniulių įleisdami čia,
you can inject a so-called vector,
jūs galite injekuoti taip vadinamą vektorių
and it will be stable.
ir jisai bus stabilus.
For it will not spread, for
It
we
is
have a
never-
fibrotic area. So it's a difference to these two compartments in the middle, yeah?
Yra
So
skirtumas
here
tarp
with the
tų
cannula, it's like butter, boom, 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 boom.
dviejų
But
ląstelių.
here, it is painful and sometimes very difficult. So the
Čia yra labai skausminga
hyaluronic
visuomenė, yra
acid
labai
cannot
sunku.
spread, so you give a nice projection here and
Ar
you
bus
give a
galite
support
geriau injekuoti va, kur jūs
for the
dabar.
mandibular line and for the nasolabial fold.
Ir bus nazolabialinė linija taip pat išsaugota.
So, when we are talking about superficial fat, we
Kai
have
mes
to talk
kalbame
about
apie
the deep
paviršinius
fat.
riebalus,
And the border is the SMAS.
ir riba
Level
yra
number
šimas.
3, superficial musculo-aponeurotic system.
Yra
SMAS.
SMAS, paviršinė mūsų raumeninė aponeurotinė sistema.
So this is the mobile zone of our face. Here all the mimic muscles have to go
Tai yra veido
through.
mimikos raumenys
And below,
ir apačioje
Girlov, 2012, so it's not so long
2009
ago,
metais
he injected contrasted liquid to the
buvo
body.
injekuotas kontrastinis skystis
And he found this compartment. He
ir
called
jis
it
rado šias ląstelinius dalis.
pre-maxillary, he called it the deep
Vieną jis
medial
pavadino
fat compartment.
DMC,
The SUF, he called it the medial SUF and the lateral SUF.
ir pavadino taip pat dar vidinių ir šoninių ląsteliniais.
The most important compartment is the deep
Svarbiausias ląstelinas yra,
medial compartment.
yra medialinės dalies, DMC medial.
But I tell you,
Bet aš jums pasakysiu,
I don't think that they are fat compartments.
aš nemanau, kad tai yra riebaliniai ląstelinai.
If you inject a bolus of hyaluronic acid into fat, so
Jeigu
for
injekuosim hialurono
example into the
riebalus
subcutaneous fat,
į poodinių riebalų ląsteliną subkutaninių,
you can do a massage as you want. You will have a bubble, yeah? So
jūs
it's
turėsite
very
burbulą,
hard
net kad ir kaip jūs
to make
masažuotumėte tą
this
vietą.
hyaluronic acid spread within the fat.
Nes hialurono rūgštis pasiskirsto riebaluose.
So in this area we have spaces.
Šioje zonoje
Spaces
mes turim erdves,
which are surrounded by fat, of
kur
course.
tarpus ir ertmes, kurios yra apsuptos riebalų.
And there are publications from 2000 from Mendelssohn in Australia.
Ir nuo 2000-ųjų Mendelsono Australijos publikacijose.
And he always was talking about spaces.
Ir jis visada buvo kalbantis apie erdves.
This deep medial
Erdves.
compartment of Girlov is the maxillary space of Mendelssohn.
Tai
Maxillary space.
maksillarinė Mendelio ertmė.
But it is the most important space
Bet tai yra pati svarbiausia ertmė,
to correct mid-face projection. So
koreguoti
give volume to the
vidinio
mid-face.
veido išsikišimus.
It's the most important place.
Tai yra
Why?
pati svarbiausia vieta.
This is filled now
Ji
by
dabar yra
the contrasted
užpildyta
liquid.
kontrastinių skysčių.
If we lose projection in the maxillary bone,
Jeigu mes prarandame maksiliarinio kaulo išsikišimą
and we compare this with a backpack,
ir mes palyginame tai su kuprinė,
Rucksack.
backpack,
with a rucksack.
rucksack, vokiškai,
You don't speak Russian.
backpack, kuprinė,
Not anymore.
borsa.
So, this backpack, during the aging process,
Šitą kuprinė dėl senėjimo proceso,
when we start, it is full of oranges.
Kai mes pradėtume su pilnu oranžiniu kontrastiniu skysčiu.
With 25 we take out 1 orange.
Ir arba, pavyzdžiui, kaip apelsinai, 25
With 30 we
surenkame
take
vieną.
out 2 oranges.
Arba 2 apelsinus.
With 35, 3 oranges. And
25
so on.
3 apelsinus.
What happens with the backpack? What happens with the projection of the backpack?
Kada kuprinė būna labiau išsikišusi.
When it's full?
Think about a backpack when it is full, when you take out some pieces, what happens?
It says.
Yeah, it gets empty, of course, but the rest of the things which are inside,
Sagging down.
it is sagging down, yeah? So the projection from this way, yeah, goes down like this way.
Taigi įsikišimas iš tokio
So it
pasidaro
is
toks.
dropping down, like a
Tai yra
drop, yeah?
meta kuprinė žemyn.
Hanging down. It's like,
Nukreipia ją
sorry
žemyn.
for that, but it is like the breast after breastfeeding.
Tai
Yeah?
maždaug kaip
So
krūtis po
when the breast
maitinimo
is
krūtimi.
losing volume,
Krūtis
it
praranda
goes down.
svorį ir jinai juda žemyn.
Don't worry.
Nesijaudink.
Some other things will also go down. What is the plastic surgeon
Kas
doing?
yra plastikos chirurgo užduotis?
They are always talking about lifting. It is not true. It's not a lifting. It
Jie
is
kalba apie veido
projection.
kosmetiką.
Yeah.
nors iš tikrųjų tai
So
yra
when you give an
kiekvienas
implant,
įsikišimas.
Yeah, you give back projection.
Mes
You change the
surandame įsikišimą
projection
ir jį
which
pakeičiame.
was changed before by the aging process. Yeah? So you give back the projection. In some cases, of course, it's over projected. Yeah?
Jeigu yra pernelyg
If you
daug
give a
įsikišę,
normal implant, you give back the projection.
ir
And
su
that's
normaliu
what we
implantu
are doing when we are injecting the deep compartment. We give back the projection. And when we look where it is located, so normally it is also here. When you give back projection, you will give also a
Jeigu mes
support.
padarome atbulinę
soup,
korekciją
automatically.
įsikišimo, mes iš karto suteikiame ir jam atramą.
And that's why when you press with your
Ir todėl,
finger here
todėl, kadangi jūs
on
spaudžiate,
an aging face, you will see that automatically the SUF area will be corrected.
kad iš karto visa zona bus koreguota.
And
That's
in
correct one.
all faces, when they are looking sad and tired,
Ir
yeah,
visi veidai, kai mes atrodysime nuliūdę,
they
ir
all have
panašiai,
a loss of volume here.
yra prarandamas tūris po akimis.
Most of the doctors start to inject here, right?
Dauguma daktarų pradeda injekuoti čia.
But you know, huh? When
Bet
you,
jūs žinote,
when you are aged
kai jūs
have a loss of volume
garbingo
here.
amžiaus
and you smile a little bit, just a little bit,
ir jūs šypsotės truputėlį, tik tai truputėlį.
and now think how it changes, yeah,
Ir dabar
just by
galvokime,
smiling.
kaip keičiasi.
So and now you correct
Dabar
this
jūs koreguojate
area
šią zoną,
with hyaluronic acid
hialurono rūgštimi,
until it looks normal.
kol jinai pradeda atrodyti normaliai.
And then they start to smile.
Ir jūs pradedate šypsotis.
Then you have the result of your magazines, of all the celebrities you can see in
Jūs
US.
gaunate rezultatą visų
They
žymių,
smile and
kurias
they
jūs
get
matote
big oranges in the
žurnaluose.
face. Yeah. Yeah? So it is looking not normal.
Tai irgi pradeda atrodyti
When
nelabai
you start
normaliai.
here,
Jeigu pradedame čia,
you support
Jūs
this
paremiate.
area, and of course you need probably a little bit, but not too much.
bet jums iš
So
tikrųjų reikia truputėlį,
then
bet
with
nedaug.
0.2 you can correct even this
Su
area, and
viską
then you
bus
have a
galima
more
koreguoti netgi šią zoną.
natural result.
Pasiekti natūralių rezultatų.
And then there is a deep lateral compartment.
Ir taip pat yra gilusis po lateralinis ląstelynas.
The origin is also pre-zygomatic. So it's a pre-zygomatic space, but it is looking,
Prezitomatinė erdvė.
this space is dropping down like a stalactite.
Šita erdvė krenta žemyn panašiai kaip stalaktitas.
And when we fill up this compartment,
Ir jeigu mes užpildome šį ląstelyną,
we can nicely correct a hollow cheek.
mes galime gražiai pataisyti
For the
išsikišusį
projection
skruostą.
comes from the depth. And you need only 0.3 of a
Ir mums
product.
reikia 0,3 tik tai produkto.
Not 3 or 4 syringes like superficial.
0,3
So it's
injekcijas.
much better and a much economic way to fill up a hollow cheek to inject the deep lateral compartment. So this is the reason why I think
Štai tai yra
that
priežastis, dėl kurios aš
there are not fat compartments, but
Tai
there are
tie-
spaces.
tie podiniai ląsteliniai, tos podinės ertmės,
This is the SUF.
čia yra nuraminimas, sušvelninimas,
So orbital retaining ligament,
orbitalinis laikomoji sausgyslė,
zygomatic ligament,
taip pat
zygomatic ligament.
zaikomatinė sausgyslė.
And look here inside space we
Ir
have
aplink
fat.
ertmės yra
Yeah. So surrounded of this pre-zygomatic space is of course fat.
ir ta ertmė be abejo apsupa riebalai.
But the injection is in a space.
Bet injekcija ir vyksta į ertmę.
So and how can we inject a compartment in an atraumatic way?
Ir kaip mes galime injekuoti į ląstelinę netraumatizuotų būdas.
When we enter the space with a cannula.
Kai mes įdurėme į ertmę su kaniule.
And how are we doing it?
Ir kaip mes tą darome,
So on all the congresses you see
visose kongresuose jūs
that when they
matydavote,
are using cannula,
kad naudojama kaniulė.
right?
Taip.
Like a torero. Pam, pam, pam.
Kaip toreadoras, torero.
Yeah?
Torero.
But a torero
Kaip toreadoras.
is a difference to a doctor. You know the
Bet tai
difference?
yra kita daktarų specializacija.
You know the difference between a torero and a doctor? Of course. What is the difference?
Koks skirtumas tarp torero, tarp toreadoro ir daktaro?
Should be.
Turėtų būti
Why?
skirtumas. Kodėl? Nes abu
The torero wants to kill the bull. Yeah?
Toreadoras
You
nori
want to
vaikus
kill your
pjauti.
patient? No. No. Okay. So a difference between a torero and a doctor. But it is stupid.
Bet tai yra kvaila.
This, for example, is a compartment.
Tai, sakykime, yra ertmė.
Think that this compartment is a swimming pool.
Pagalvokit, kad ertmė yra plaukimo baseinas.
And we have to fill up the swimming pool
Ir
by
mes
a
turime
tube.
užpilti baseiną.
Yeah, so we need a tube like the firemen, and to fill up a swimming pool
Ir mums
with a
reikia
tube.
tokio vamzdžio kaip gaisrininkai turi, kad užpildyti
Have
visą
you
baseiną.
ever seen somebody coming in with a tube, first going to this corner, open the water,
Ir
1,000
kaip jūs manote,
liter
ar
here,
matėte, kad nors žmonės
going back, going to this corner, open the water, 1,000 liter, going back, going to all the corners
einant į
with
po
the
visus
tube?
kampus,
Never.
niekada.
To fill up the swimming pool, you
Norint užpildyti
enter,
baseiną yra
you put the tube in the center of the swimming pool,
Vamzdis
you
yra
open the
padedamas į
water
baseino
and the
centrą.
swimming pool will fill up.
Ir
Right?
vanduo bus pakilęs.
So we don't need to do
Mums
this
nereikia padaryti
movement.
va taip, kaip toreadorai.
Just we need to enter the space.
Mums tik tai reikia
You give a bolus of your hyaluronic acid.
hialurono rūgštimi.
It's of course it's not water, so it is
Žinoma,
a
tai nėra
gel.
vanduo.
And then you press
Ir jūs
with your finger, and the hyaluronic acid will spread
Ir hialurono rūgštis paskirti
within the compartment.
po visą ertmę.
This is the big difference in understanding how to inject compartments.
Tai yra didelis skirtumas ir
Enter, you fill up, you go out. Without,
be toreadoro judesių.
The cannula
Kaniulė
is an instrument of love.
yra meilės instrumentas.
The cannula is an instrument
Kaniulė
of
yra
love.
meilės instrumentas.
Gentle.
Švelniai.
You go, you move it like this. And then you knock on the door.
Po to jūs
With your cannula.
ateinate, pasisuksenate į duris
And then with a little bit of pressure.
ir po to su truputėliu
And you can
spaudimo.
feel how you fall inside the swimming pool.
Ir jūs galite pajausti, kaip jūs įkrentate į vidų baseiną.
And then you are inside,
Kai jūs esate
you
viduje,
inject, you fill it up, and then you give a massage.
tada jūs injekuojate ir
Gentle.
padarote didelį
All
masažą.
our
masažą.
movements are gentle,
Visi mūsų judesiai yra švelnūs.
with love.
Kaip meilėje.
Good.
Gerai.
How are the deep compartments, or which are the main deep compartments?
Taigi, kur
They
yra
are under the
giliosios
smas.
ertmės?
Under the smas, so the orbicularis oculi muscle is part of the smas. It is the lateral SUV,
Taip
The
pat
medial SUV, the deep medial compartment,
aurikularinio
and the deep
Ertmė.
lateral compartment.
ir giliojo medialinio skruosto riebalų ertmė.
You don't need to translate it.
Nereikia versti, sako, aš viskas logiškai.
So, the roof of the SUV is the orbital retaining ligament. Yeah? So it's the ligament around the orbit. Roof of the SUV. The bottom of the SUV is the zygomatic ligament.
Apačioje yra zigomatinis sausgyslė.
The inferior lateral border of the
Žeminė
deep
inferior
lateral
lateralinė
compartment
riba
is the zygomatic major muscle.
yra stambus raumuo. Reikšmingas
The
raumuo.
zygomatic major muscle,
Zigomatinis
is this a strong muscle?
Musculus zigomaticus major.
How does it look like, the zygomatic major muscle?
Kaip jis atrodo, tas musculus zigomaticus
How
major?
does the zygomatic major muscle look like?
Musculus zigomaticus major.
It is probably written somewhere.
Tai yra turbūt kažkur tai parašyta. Gray's Anatomy. Gray's Anatomy.
Gray's Anatomy. It's a strong muscle or a
Ar
small?
tai yra stiprus raumuo ar ne?
When I'm asking like this,
Kodėl aš pasiklausiu taip?
when I'm asking like this, it is a nothing of muscle. It's a
Joks neraumuo.
It's nothing. It's 1 millimeter thick, yeah? So this cannot be a border. But
Tai šitas negali būti riba.
when we do a right dissection,
Kai
then
mes
we
darome
find
gerą
a
disekciją,
septum right under the zygomatic major muscle. We find a septum to the bone. So
mes
then we
randame
have the wall, we have the border to our swimming pool deep lateral compartment.
į gilų į šoninį lateralinį ertmę, ląstelinę.
In between the deep medial and the deep lateral compartment,
Tarp šių dviejų
there is another anatomical landmark, which is
yra dar
the,
viena anatominė
facial
svarbi
vein.
vieta.
always the facial vein.
Yra absoliut veido vena. Vena facialis.
But how does the facial vein look like?
Bet kaip atrodo veidinė vena, veido vena?
Nothing. It is just this is the facial vein, yeah?
Šitas.
Can it be
Panašiai
a
kaip-
border?
Kaip šitas va, kroviklis.
Can it be a border?
Ar
No.
tai gali būti riba? Ne, negali.
Again, Gray's Anatomy.
Ir vėl Grėjos anatomija.
Basic medicine.
Pradinė, pagrindinė medicina, bazinė medicina.
Where are the big vessels running in our extremities?
Kur yra didžiosios kraujagyslės
Always.
tekančios į mūsų galūnes?
If I know, tell me.
Ah. But you should know.
Bet jūs turėtume žinoti.
Basic medicine.
Bazinė medicina.
Emergency
I
room.
didn't study it. I'm just a
But basic medicine. Emergency room.
Bazinė
Where
medicina,
are the
pagrindinės
big
skubios
vessels
pagalbos
running?
taisyklės.
Always within a septum. Yeah? So the big vessels are always in a septum. We have the septum of the facial vein. And then, yeah, it's a shock for the microphone. And then we have the facial artery. Round about 60% of the Caucasian population, the facial artery is running in the nasolabial fold. Yeah? The nasolabial fold is also kind of a septum. It is more a ligament than a septum. Yeah? So, in the nasolabial fold, in 1/3 of Caucasians, the artery is following the vein. So when you are using needle, you must be careful, for you never know where is the artery. And then around 5-6%, the artery is running both ways, or it stops in the upper labial artery, yeah, with a lot of variation. Good. So, typical face. Coming to us here, sagging, volume loose, yeah, and before we start to inject, we have to know the landmarks. Orbital rim for the orbital retaining. Definition, where is the zygomatic ligament? The zygomatic ligament we can find and detect in almost every face. It's like this shadow here. Yeah? More or less, this shadow here. Why? For it is a true ligament. It is from the bone to the skin. Even in children we can see the shadow of the zygomatic ligament. In some people we can see it more, in some people less. Yeah? But in case of our patients, they are mainly claiming and they say, I don't like this. Look here, it is so ugly. Good. When you fill the compartments immediately, it will be better. Yeah? Sometimes you can do what you want, you cannot eliminate. In some patients, we cannot change it. Yeah? You can make it better, but it will not disappear. Good. Then we have to find out where is the modulus. The modulus is, we smile, a small dimple, half a centimeter lateral the commissure. Why we need it? For that we know how the zygomatic major muscle is running. It is coming from the zygoma, yeah, running to the modulus. Why we know it? For to know where is our lateral compartment. Below is the septum. Then we have to know where is the masseteric muscle. What for we need the masseteric muscle for? For our injections. Why we need to know where is the masseteric muscle? For then we know the medial border of the masseteric muscle on the bone, yeah, there is always the facial vein. The facial vein is running more or less in a line from the medial border of the masseteric muscle to the medial canthus. So this is the way of the facial vein. But in the first step it's more vertical, deep. The vein is deep,
Viena yra gili ir pradžioje jinai yra vertikali,
running up to the zygomatic ligament,
atiteka iki zigomatinio sausgyslės,
changing the name, it becomes the angular vein,
pakeičiamas jos pavadinimas, tai
and running to the
angularinė
medial
vieta.
canthus. And of course, medial,
Ir
the
žinoma,
facial
gilėje,
vein, we find the facial artery on the bone, deep on the bone.
giliai po kaulu,
This means in this mandibular area,
tai reiškia, kad šioje mandibuliarinėje
the
srityje
danger is deep. The danger
pavojus
is
yra
deep.
giliai.
Yeah? So if you want to define a jawline, you
Jeigu
have
norime
to inject
apibrėžti
superficial.
išryškinti šitas žandikaulių liniją,
In 1/3 of cases, we
vienu
know
trečiuoju atveju
the
mes
artery is
žinosime,
following the vein.
kad reikia sekti veido veną.
A small thing to show you,
Mažas dalykas jums parodyti,
if you have a tear trough deformity.
jeigu jūs turite ašarų liaukos
So
deformaciją,
here, the valley of tears, tear trough, valley of tears.
ašarų pakalnė.
What is the difference of the valley of tears to a valley outside here when you go to the mountains?
Kuo skiriasi ašarų pakalnė ir pakalnė ta, kurią mes matome atostogaudami kalnuose?
What is in the center of the valley?
Kas yra slėnio
What?
centre?
Meadow? Flat meadow?
What is meadow?
Meadow.
Meadow? What is meadow?
Whatever.
In the center of the valley,
Slėnio centre
outside in nature is always the lake. Yeah, sometimes it's a lake.
dažniausiai būna
Mainly?
ežeras,
Not the lake, but the river.
fiume,
Yeah, the river.
river,
So
upė.
outside is the river in the center of the valley. In the tear trough deformity, the valley is below.
Upė
So
yra,
in the center
latakas
of the
yra
tear trough,
centre.
you should be safe even with a needle.
Taigi
Yeah.
jums būtų
So when
netgi
you
saugu
go
ir
directly to the center,
netgi su
there
akla.
should be no risk, for there is no vessel. Yeah, the vessel is outside. Good. Here
Gerai.
you see another
Ir kas
design
matote?
on a face.
Kitą veidą.
So orbital retaining ligament. Probably we can shut down the light here. Yeah.
O mes galime išjungti šviesą, dabar matysim.
Orbital retaining ligament. Zygomatic ligament.
Zigomatinė
Mesenteric
sausgyslė, musculus mesentericus,
Modiolus. Zygomatic major muscle.
musculus zigomaticus.
Below we find the facial transversal sector.
Taip pat mes matome veido pasikeitimo sektorių.
Medially the mesenteric muscle, the facial vein.
Veido veną.
Normally medially the artery, both deep on the bone. The facial artery normally
Veido
is
arterija
running,
normaliai teka.
is running lateral to the modiolus. So it's always
Laterally.
lateral the modiolus. It is always under the zygomatic major muscle. So
Jin
it is
visuomet
deep.
po zigomatinių pagrindinių raumenių.
Right after the modiolus, the artery comes up.
Ir iš karto po jo arterija išsišauna į viršų.
And then the artery gives the superior labial artery,
Ir tuomet arterija duoda pradžias arterija superioris labialis,
which is above the orbicularis oris muscle.
kuri yra
So it
virš
is above.
orbicularis oris musculus.
And then it perforates the muscle.
Ir jį persmeigia raumenį.
And then we find the artery between mucosa and the muscle.
Ir mes randame arteriją tarp raumenų ir gleivinės.
More medially we go, more
Kuo daugiau mes keliai
superficially,
mes einame,
more
Kuo arčiau
superficially the
paviršiaus.
artery returns.
tuo arčiau paviršiaus arterija iškyla.
Then it is running
Kai jinai teka,
in
running
the
teka,
filtrum, more and more superficially,
kuo arčiau paviršiaus,
changes the names, becomes the columellar artery, which is an end artery of the tip of the nose.
tuoj pat matome ir arteriją, kur yra nosies galiukas, teka į nosies galiuką.
The facial artery
Veido
within
arterija,
the nasolabial fold has
teka
a
pro nazolabialinį
behavior
plyšį
like a dolphin.
ir jį neria jį kaip delfinas.
It is going up, going down.
Tai aukštyn, tai žemyn, tai aukštyn, tai žemyn.
In the nasolabial fold, we never know where is the artery.
Nazolabialinėje ertmėje mes niekada nežinome, kur yra
So we can find it
kritimas aukštyn,
subcutaneous.
kur yra kilimas žemyn.
We
Kilimas
can
žemyn
find
ir
it a
kilimas
little bit
aukštyn.
deeper in the fat. We can find it within the fibers of the levator labii superioris.
Mes galime matyti,
So the artery is running up and down.
kad arterija eina tai į apačią, tai į viršų.
But it is never on the bone.
Bet niekada tai nėra
It's never on the
kaulais.
bone. Then it changes the name and became the angular artery.
Jinai tokiu būdu pakeičia pavadinimą ir yra vadinama anguliarinė arterija.
Makes an anastomosis with the supratrochlear artery
Su anastomozė su trochlearinė
and
arterija
supraorbital artery.
ir supraorbitalinė arterija.
At the bottom of the nose, we have mainly a strong anastomosis to the other side.
Ir nosies gale mes matome pačią ryškiausią anastomozę.
Dorsal nasal artery
Dorsalinė nasalinė arterija
mainly is a little bit lateral of the dorsal.
dažniausiai yra lateralinė,
But this is not always like
bet tai
this.
nėra visada.
We have a very wide variation.
Mes
So
turime labai plačią
sometimes
variaciją.
the dorsal nasal artery is
Dorsalinė
in the
nasalinė
center,
arterija
as
yra
the name
centre.
tells us. Sometimes it
Kai
is
kuriais atvejais
unilateral,
ji yra viename šone, unilateralinė,
giving to the other side an anastomosis.
sudarantis sąlygas anastomozijai.
So the nose is a
Kitoje
very
pusėje.
delicate place.
Taigi nosis yra labai delikati vieta.
Inferior nasal artery and arteria for the ala of the
Yes.
cannula. We are separating
Superior.
the muscle. We go back.
Mes einame atgal.
At the entrance, we give a small bolus,
Ir mes
even of volume, doesn't matter. Small bolus of volume.
mažą poliusą.
And then, so in the Russian,
Bet to nesesualė.
say, so you give a sexy vector
And
on
the
the
proof
bone.
sexual
We are
life.
sliding on the bone above the zygomatic arch, automatically the
Ir tada
periosteum
automatiškai
and the deep temporal fascia is the same layer.
vidinė
So you are
temporalinė fascija lieka
sliding
tam pačiam lygyje
above the zygomatic arch,
ir prie musculus zygomatikus.
and then there
tada-
you give a bolus 0,1.
Ir
1
tada
centimeter back,
leidžiama
0,1.
0,1
1 centimeter back, 0,1 of volume. Then you make a massage and you have a nice projection.
Ir jūs darote masažą ir paliekate.
And as the zygomatic ligament is a strong border,
Ir kadangi ligamentų zygomatikus yra stipri riba,
this material will never migrate down.
ši medžiaga
So
nenumigruoja.
we will have a very nice, stable,
Ir gauname labai
sexy
gražų,
vector.
stabilų ir seksualų odos veido koregavimą.
And if we have a man with hollow cheeks or even a woman with hollow cheeks,
Jeigu mes turime
You go
sujudusiais skruostais
perpendicular
vyrą arba
down.
moterį,
first resistance, zygomatic ligament, we go tuck through,
ir mes
you lift up the cannula,
įsiveikia
and
per
we have
jį, po to
to
jį pakeliame.
perforate the smuts.
kad jis
So you
persmėgtų
take it
šią
like this, and you go plop through the smuts.
šią vietą ir einame
Small bolus 0,3
mažą
in this lateral part, and you will get a nice projection.
gauname labai gražų efektyvų rezultatą.
So here, to understand it a little bit in a different way with the spaces, here is the soup.
Ir čia matome kaip tik
From the soup you can reach the teardrop. From the soup you can reach the premaxillary space, so the deep medial compartment. From the soup we can correct the palpebromalar groove. From the soup we can correct the deep lateral compartment.
Ir mes galime susisiekti su lateralinė giliaja ertme.
And from the same point, if needed,
Ir iš tos
and if
pačios
the
pusės,
patient
jeigu
has the
reikia-
money to pay a third syringe, for example,
Jeigu pacientas turi pinigų apmokėti už trečią injekciją,
in a fanning technique subdermal, you go with deep wrinkles.
jūs dirbate su giliomis raukšlėmis.
If you still need to correct a little bit the nasolabial fold, you come from the same point. You have to perforate the nasolabial fold.
Ir jums reikia
Give a small bolus,
nasolabialinį
0,1.
plyšį.
If it's very deep, you give a second bolus here, and then you massage. Then, normally my cannula reaches to the modulus.
Ir
If you have a marionette line, you just push back the soft tissue like a
Ir
curtain,
mes atstumėme atgal minkštą jaudinį.
and you give also a support to the marionette line.
Ir mes taip pat suteikėme atramą mandibuliariniai.
So, from one single entry point, you can correct the whole midface.
Taigi jūs galite su vienu įsmeigimu koreguoti praktiškai visą veido vidurį.
And Hassan Galadari, who did the
Ir Hasan Galadari,
ghostwriting for this publication, named this point the Redka-Galadari point. RG. It's not the G point, it's the RG.
Ne G taškas, bet RG taškas.
Good.
Gerai.
This, for example, was a model in Ukraine
Tai va, pavyzdžiui, buvo modelis Ukrainoje.
for biopsies, and we injected in her totally 3 ml
Ir mes į ją injekavome viso 3 ml.
of volume, and into the nasolabial fold
Į nazolabialinį plyšį.
we gave her 1 ml of medium.
Mes injekavome 1 mililitrą.
But she changed with a small amount. For
Bet ji pasikeitė
four syringes is nothing. Yeah,
po mažo skaičiaus.
for
Viskas
such
čia
a
reikia
face.
4 injekcijos yra niekas.
Normally you need 3-4 sessions.
Normaliai reikia 3-4 sesijų.
So you have with 4 ml a very nice result and a natural result.
Taigi mes turime turėti
And this
labai
was the patient
natūralų
from
rezultatą.
before with 2 ml volume.
Taigi yra apie pacientį, kuri po 2
Where we
mililitrų.
even corrected nasolabial
Ir
fold.
netgi pakoregavo ją ir
Look how it
nazolabialinį
changed.
plyšį.
Yeah, all from only a single entry point.
Tik tai nuo vieno
This lady was not injected on the nasolabial fold.
ir ta nebuvo injekuojama nazolabialinė injekcija.
One short word to cannulas.
Dabar turėtume kalbėti apie kaniulius.
There are different cannulas on the market.
Yra rinkoje įvairių kaniulių.
One, the first one, the TSK, is normally my preferred one, which I'm using.
TSK yra mano pati mėgstamiausia, kurią aš preferiju.
Why?
Mėgstu labiausiai naudoti.
It is very precise as the hole is very close to the tip.
Ir jos yra labai arti, labai siauras galiukas. Antgalis.
And what you can see, the tip is different to all the others.
Kaip jūs matote, antgalis yra skirtingas negu visų kitų.
The tip is like a conus.
Antgalis yra kaip kūgis.
So it's like a boat which is running through the rivers.
Tai panašiai kaip laivas, kuris teka, kuris plaukia per upę.
easy sliding,
Lengvas slydimas.
very precise on lips or tear trough.
Labai preciziškas į lūpas arba į ašarų lataką.
But you must be careful in
Bet jūs turite būti
areas
atsargus,
where the artery is fixed.
kur arterija yra sutvarkoma.
Where is the artery fixed? At the modulus. Yeah? So when you enter here with a cannula,
Jeigu įeinate
in the area of the commissure of the mouth, you must be careful.
burnos komisūrose,
For as it has a conus, and the artery cannot slip away.
kad arterija negalėtų paklysti.
When you are too deep, you can easily enter the artery.
Jūs galite lengvai pasiekti arteriją.
And then you have the problem that the opening is right after the tip. So you don't need just to enter a lot into the artery, just a little bit, and you can have a vascular problem even
Ir
with
jeigu jūs per daug įsiveržite į arteriją, jūs turėsite vaskuliarinę, tai yra kraujagyslinę problemą.
The same is when you are injecting noses, especially after a rhinoplasty.
Ir taip pat panaši problema bus ir injekuojant į nosį, ypač po rinoplastikos operacijos.
So in those areas, all other cannulas on the market seem to be a little bit safer.
Tuo aspektu kiti kaniuliai, kurie yra rinkoje, jie atrodo
First,
truputėlį
they are
saugesni.
really blunt.
Kurie yra labai buki.
This means it's
Tai reiškia-
more easy that they will go away from even a rigid structure, even if it is
Jie
fixed.
atšoksto kraujagyslės arba kietesnės struktūros.
Second, the holes are far away from the tip, which is less
Viskas yra toli
precise.
nuo angelio.
But even if you enter a vessel, yeah, the risk that you inject inside is lower.
Įeisite į kraujagyslę, jūs rizika, kad jūs sugadinsite vidų, yra daug mažesnė.
Good.
Gerai.
Now we have a short lips, yeah, and then we make the next break, right?
Dabar mes darome trumpą.
So, in the perioral area, we have different arrangement of the subcutaneous layer.
Mes matome įvairų poodinio sluoksnių išdėstymą.
So the type 1 we know
Tipas
from
vienas,
everywhere,
pirmas
it
tipas.
is skin, fat, muscle, yeah? Skin, fat, muscle.
Odos
In the perioral area-
oda, riebalai, raumenys.
We have skin, we have a fibrotic area, and then the muscle.
Antras tipas mes turime odą, po to turim fibrozinę zoną ir po to raumenį.
The fibrotic area are muscle fibers and collagen fibers.
Fibrotinė zona susideda iš raumenų, spasijų ir
And within these fibers we have some fat.
mes turime tam tikrus slėginius.
Some modern publications now
Kai kurios modernios
are talking
publikacijos
about
dabar
white fat. Yeah?
sako,
But
kad
it's
yra-
not as the fat is white, the thing is,
Sako, yra baltieji
due to the
riebalai.
fibrotic area, it seems white in this
Tai
area.
yra fibrotinė zona, todėl
Good.
joje atrodo, kad yra raumenynas.
We know it all from the barcode lines. When you go
Mes
with the
žinome viską
cannula,
apie
it's difficult, huh? Good. Lip formation.
lūpų anatomiją, lūpų susidarimas.
Remember that we have this hockey racket-like
Kad mes
formation
turime
of the
ledo rytulio
orbicularis
ritmušos
oris.
pavydalo formaciją.
Be careful in the area.
Būkite atsargų šioje
The
teritorijoje,
main
zonoje,
artery
nes pagrindinė arterija
is always in cosa and muscle.
yra visada tarp kozo ir muslo.
A nice area to lift up the mouth corner and to correct marionette lines
Gera vieta pakelti raumens
is the lateral part of the lower lip.
Yra
You make this
kuisoje.
horizontal cut,
Ir
you
padaroma
see
horizontalų pjūvį, galima
that
matyti,
there are two layers of muscle.
kad yra du raumenų sluoksniai.
The deep layer is
Gilusis
the
sluoksnis,
buccalis muscle.
kuris bukatis.
Superficial layer is the orbicularis oris.
Paviršinė zona yra musculus orbicularis.
Lateral, in between these two layers, we have
Lateraliai šiems dviems sluoksniams, tarp šių dviejų sluoksnių,
in between this fat, these two muscles
tarp šių dviejų raumenų
interchange fibers.
Yra tam tikros fascijos.
When you go perpendicular down with the
Jeigu eina
needle,
statmenai, perpendikular statmenai,
which is
į
delivered
apačią,
with the product, whole length, and you give a small bolus,
ir mes
0,1,
suteikiame mažą
you
bolusą.
go out, you make one
Injekuojame.
pressure with your finger up, you have a nice correction of
Ir
this.
gauname labai gražų koregavimą.
Here you see how thick it is, a 25 gauge cannula.
Va jūs matote, kokio storio yra
How thick
25
is the
kalibro kaniulė.
nasolabial artery in the facial artery in the nasolabial fold. Yeah. So this is the artery. This is the 25 gauge.
Čia yra arterija ir yra 25 mm kaniulė.
Here you see the labial artery. How
Čia
thick
matote
it
labialinę
is.
arteriją, kokia jinai
So
yra.
it is easy to hit the
Arterija
labial artery.
labialis.
So, about the anatomy of the lips. The upper lip,
Apie lūpų anatomiją.
the upper lip you have to know are three parts, three pieces. Yeah?
Viršutinės lūpos yra
From
3 dalis.
embryology.
Nuo
So,
embriologijos.
we have our maxillary process, the maxillary process, which is coming forward,
Mes turime maksiliarinį procesą, kuris išsikiša
and it makes a fusion with the medial nasal
ir kuris
process.
susijungia su medialinė nazalinė erdvė.
And the fusion line
Ir
is the
susijungimo lygiai yra
filtrum. So,
ryški.
here you see again
Matome embriologinį vystymąsi.
the maxillary process,
Maksiliarinis
the
procesas
medial nasal
ir
process.
MNP,
And
vidurio
in the
nazalinis
center,
procesas.
Here the fusion line
Ir
is
čia yra va susijungimo
the
lygija.
filtrum. Yeah?
Ir kurį
So,
matome
The
filtruojamą.
fusion line is the filtrum. Another skin.
Embriologinis filtras.
The lower lip are two parts. And there is a
Apatinė
fusion
lūpa
line
turi 2 dalis.
of the mandibular process. So the mandibular process also comes together.
Taigi mandibuliarinis procesas taip pat vyksta.
And there we also have a fusion line in the center. And you remember there is a nice guy from UK,
Jūs atsimenate, yra gražus vyras iš
Bob Canna,
Bob Canna,
who
iš
is
Anglijos.
telling us Hartley lips. And he gives his patient, before he is injecting the lower lip, a dental floss.
Kuris prieš injekuodamas į apatinę lūpą duoda pacientam dental floss dantų siūlą.
He puts the dental floss into the two incisiva in the center,
Į kandžius, į dantis kandžius.
and then the patient has to hold the dental floss. And then he's injecting one bolus and one
Ir
bolus.
tada jis po to injekuoja vieną ir vieną injekcijas.
For Hartley lips. It's a marketing stupidity.
Ar tai yra tik tai marketinginė kvailystė?
For there is a fusion line, you know, the two mandibular process come together, so we have a border here. So just don't penetrate the border, just give a bolus here, just give a bolus from the other side and you have Hartley lips. Yeah? So you don't need to play with dental floss.
Tai netgi nereikia žaisti su dantų siūlu.
Classical way of lip contouring is the old way.
Kontūravimo būdas.
I tell you, the most simple way to make a lip contour is to go along the contour.
Ir
How we
paprasčiausias
did it
būdas
20
kontūruoti
years.
lūpas yra eiti palei visą jų kontūrą.
I have never seen so many complications on lips as nowadays.
Niekada Kaip dabar aš nejaučiu tiek daug komplikacijų su
On
lūpomis, kaip yra dabar.
every congress, on everywhere,
Tiek žinau kongresų, kur yra
everywhere
dabar.
where you go, a new technique from this way, this way, this way. I don't know. No, why we continue with
Kodėl mes
a
tęsiame?
very simple
Tai yra
technique?
paprastas būdas.
I never ever
Aš niekada
for 15 years heard about lip necrosis, and since 5 years, since everybody invents a new technique, a French kiss, and how you call it, ba, 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 ba. So we have problems with lips. So
Taigi mes turime problemą su lūpomis.
good. Be careful volumizing in the upper lip. We have 3 parts.
Būkite atsargus viršutinė
But
lūpa,
always,
mes turime
sometimes.
3 dalis.
So there are some patients who need also in the center of the upper lip a small bolus. Yeah?
Yra pacientų, kuriems reikia
And in the lower lip,
mažos
of course,
injekcijos
we have 2 boluses
į
each side.
viršutinės lūpos centrą.
Don't forget the filtrum, but
Nepamirškite filtravimo.
we are not anymore injecting the whole filtrum as we did,
Mes
For a long time.
filtro
for it's ugly.
neinjekuojame,
And
kaip
it is
anksčiau.
looking not naturally.
Tai atrodo nenatūraliai.
So, if you have especially older patients,
Ypač jeigu turite senesnius pacientus.
we know the older they are,
Kuo jie senesni
the
yra,
longer is the upper lip. Yeah?
tuo ilgesnė yra viršutinė lūpa.
If you inject in a 50-year-old lady
Jeigu
with
skirtuojate
barcode lines,
50 metų poniai
the whole filtrum,
visą filtrą,
she probably at the end will have a nice lip.
pabaigoje tikriausiai turės gražias lūpas.
Well, this is not beautiful. If it comes back like this. So, we have even to shorten the optic. That's why
Sutrumpinti optiką.
it's mainly enough to give just a small bolus,
Užtenka tik tai
or you go
aptikti
1
trimažas injekcijas.
millimeter into
Vienu
the filtrum
milimetru.
just to accentuate the filtrum.
Kad pabrėžti lūpų kontūrus. Akcentai.
This is to lift the mouth corner I showed you on the other side. And then we can do all the procedure with cannula.
Ir taip pat mes galime atlikti visą procedūrą su kaniuliais.
Years ago, I did the cannula injection only from one entrance point,
Anksčiau aš darydavau kaniulio injekcijas tik vienoje vietoje.
outside the red of the lip.
Šalia raudonio lūpų.
But it is quite difficult to find the way into the center of the lip.
Rasti kelią į lūpos centrą.
So when you are coming from the vermilion, a few millimeters from the border, from the mouth corner,
Taigi, jeigu keli
and you
milimetrai
go
nuo lūpos
horizontally, it is very easy to enter and almost painless or with low
yra labai
pain.
lengva ir neskausminga atlikti šitą.
A very simple and nice way to give volume in the
Yra labai
upper
paprastas ir
and lower.
gražus būdas. juos
And of course,
injekuoti.
with the cannula you can do also the contour.
Ir su kaniuliais, jūs žinoma, galite padaryti ir kontūrus.
The lower lip is very easy,
Apatinė lūpa yra labai lengva.
but on the upper lip sometimes it hurts more than when you do it with a needle.
Viršutinė lūpa truputėlį skauda labiau, negu jūs darote, kai suvalgote.
And of course, if you have barcode lines with a cannula, you can even correct a little bit the barcode lines, subcutaneous.
Žinoma, taip pat galima subkutaninę korekciją atlikti.
Here you see just 1.5 millimeter
Čia jūs
or
matote
2
tik
millimeter
pusantro
of filtrum.
2 milimetrų.
No volume, no volume. This was not injected without no volume. Just a little bit of filtrum, how to
Tik
change
labai mažytė injekcija.
the angle of the upper lip and
Ir
how
kaip yra
it looks
pakytęs
shorter.
viršutinės lūpos kampas.
Good. If we have this result, this should be our result.
Jeigu mes turime šį
I
rezultatą,
don't
turbūt
know.
bus
I
rezultatas.
don't know why in some countries they like these big lips. To tell you the truth, since
Norėdamas pasakyti jums tiesą,
I am using
kadangi aš naudoju
mostly cannula for lips
Daugiausia kaniuliai lūpoms,
is for volumizing, yeah?
jų užpildymui,
Especially in young ladies.
ypač jaunoms moteriams.
They normally have very nice shape of lips.
Jos turi labai gerą lūpų formą.
In this case,
Šiuo atveju
I don't inject anymore the vermilion border. I don't give contour of lips in young lady. I only inject volume, and giving the volume on the right place makes a nice E version of the lip, yeah, without touching the vermilion border.
Ir neliečiant raudonio ribos, aš patvarkau, kad lūpa atrodytų idealiai.
We have so many beautiful young
Mes
lips
turime tiek jaunų
from the
gražių
shape.
moterų.
And once you touch it with a contour,
Ir kaip jūs
you
jas
can
paliečiate su
destroy
plonu,
the whole beauty of a lip. Good.
Gerai.
So here, mental area just to remember.
Tiek atsiminti labiau mandikuliarinė erdvė.
Of course, in the center normally there is no artery, yeah?
Nėra
But
taip.
even though I am injecting this area only with cannula and mainly in different layers. And here you see the danger of the mandibular
Čia jūs
artery.
matote pavojų dėl mandikuliarinės
You see
arterijos.
how the branches are spreading under the muscle.
Matote, kaip
So
atšakos
the danger
išplinta
is
po raumenimis.
Here you see the right position
Čia matote
is
teisingą poziciją.
for volumizing is this point, right in the center of the hockey racket.
Kaip matote,
But-
ledo ritulio ritmušos formos.
When you are
apatinė
using a
dalis.
needle, you must be careful. Sometimes you can hit a branch,
Bet kai jūs
an
turite, jūs
anastomosis
būkite labai
of
atsargus,
the
nes
labial
galite,
artery.
nes galite įdurti į arteriją.
The submucosal area for me,
Submukozinė zona,
not only for the risk of the artery,
ne tik tai dėl arterijos rizikos, bet ir
also for a risk of getting lumps, yeah, and visible irregular results.
gauti.
This area for me is a no-go for a hyaluronic acid filler. Vermilion border is a very safe area. I never have seen a lip necrosis.
Paraugimo zona yra
by a
labai
vermilion
saugi zona, nes aš niekad
Risk if something happens, you call the distributor.
Jeigu kas atsitikę, jūs
And you
skambinate
say,
distributoriui.
oh my God, what a filler you sold me. It's always the same, don't worry.
Yra visą laiką tas pats.
If you have a problem, you call him.
Okay.
But those are parts of the main risk.
Bet tai yra tik tai dalis bendros
You know who
pagrindinės
is
rizikos.
the main risk?
Kokia yra pagrindinė rizika?
The main risk for aesthetic treatment.
Estetiniam gydymui pagrindinė rizika yra
You.
jūs.
The doctor.
Daktaras,
Yeah.
gydytojas.
So the doctors, you are the main risk. Yeah. Of course, when we are talking about the patient,
Žinoma, kai mes kalbame apie
we
pacientus,
should know something about the patient.
mes turėtume
That's
žinoti,
why the
kiek
doctor
žinoti
is a main
pacientus.
risk, yeah? For you have to talk before with your patient. You have to know if they have a treatment at the moment, especially dental treatments, if they have some flu or a throat or something. Yeah?
Gripą ar gerklės lygą.
But there are many patients who nowadays they know
Tai yra labai daug pacientų,
if I say, oh yes, I don't feel good, or
sako,
something,
taip, aš nesijaučiu gerai.
that some doctors
Bet kai kurie
will
kurie
say,
gydytojai
no,
sako,
I
ne,
will not inject you
Aš
now.
neįkosiu tau.
There are some doctors who will refuse.
Yra kai kurie daktarai, kurie
Then the
atsisakys.
patients are quiet. They don't talk about illness.
Ir tada pacientai, kai kurie
Good
yra
trick.
aktyvūs, nekalba
What is the
apie
best
ligas.
trick?
Kuris
To
yra
find out if they
Geriausias
have something.
būdas
You tell them,
surasti, ar jiems kažkas tai...
are you taking some medicine?
Paprastas
For
klausimas
I
yra
have
paklausti,
to know.
Klausia, ar jūs vartojate
For
kokius vaistus?
you know, some medicine can make a problem. It's not true, it's a lie. But you have to tell them, some medicine can make severe cross reaction with the filler. So I need to know. And then they tell you, oh, of course, I take some blood pressure, I take something for diabetes, I take blah, 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 blah. So then you get the information you need. So don't ask them if they don't feel good or if they are sick. They will ask them for medication. Okay, compliance. If you see that the patient will say, ah yeah, doctor, you tell me, blah, blah, blah. You can avoid to touch such patients if you just see that they will not do what you want. Unrealistic expectancy. Newspaper, I want these lips. I want these cheeks. It's impossible. Yeah? So, stop. Be quiet and careful with these patients. Perfectionism. When they come, they look good. And they say, can you see this small asymmetry here? Can you see this small ring here? No, I don't see anything. And a doctor here! Yeah. So don't touch them, it will be really a mess. Yeah? Or undecided. When they come, so if you have an aesthetic practice, this is not the problem. But if you have a normal practice and you do aesthetics beside, and they know, oh, my doctor is also injecting, then sometimes there are patients, they come 10 times. Do you really think I need something to do? You think really my nose could be a little bit? Do you think my lips, should I do it? No, they shouldn't do anything, yeah? They only should do something if they want really to do it. So be careful. Depressive depends on. So, we know now from studies about botulinum toxin, we know that depressive disorder can be treated with toxin. Yeah? So we know that if people have these very strong glabellar lines, yeah, and they are depressive, that the mood is changing after the toxin injection. There are big studies in the US about that. Yeah? So they are looking into the mirror and they see the difference and they get more happy. But we have to be careful. Right? For depression and depression, not all depression is the same. Then we have these dysmorphophobic patients. And you know, the worst case is dysmorphophobic patient comes to a dysmorphophobic doctor. So if the doctor looks like a monster, how do you expect will the patient look like after a few treatments? And the worst are the doctor hoppers. They come, they tell you, oh look, how the last doctor injected me. Look this, that. They open, look what he did. Yeah? So all those patients should be very careful. For they can, even if there is no problem, they can make it. Fillers, of course. Hyaluronic acid fillers, it doesn't matter which brand you are using, but hyaluronic acid filler normally is well known as a safe filler. Why? Why? For we have an antidote. Yeah? So we have hyaluronidase on the market, And if something happens, we always have an option to do something. Calcium hydroxyl apatite and polylactic acid. They are not really fillers, they are stimulators. This is something which every doctor by itself has to decide. I by myself, I'm coming from general surgery. I by myself don't understand why I should use a bony substance like calcium hydroxylapatite in the soft tissue. But there are many doctors who are doing it, especially dermatologists. But for me, it's a no-go. For I did it in bone surgery, and now I should put it into the skin or under the skin. We know that there was a publication 4 years ago from the University Boston, and they found out that the age-related macular degeneration is caused by calcium hydroxyl apatite druses. So, if we know this, we should also be careful, for we never know. Who knows how our calcium hydroxyl apatite probably can reach the retina by blood vessels or something else. So, permanent fillers in Europe are not anymore on the market. Yeah? So silicone and acrylate fillers, polymethyl acrylate, are not anymore on our market, but our patients are traveling. Our patients are traveling to Russia, to Asia, to US. In US, methyl acrylate fillers are still FDA approved. So here you see how important is FDA approval. Also a big mafia, a big money deal. Yeah? So what is FDA approved? There's one of the fillers which made a lot of problems in mid-Europe in the years 2004, 5, 6, 7, 8, which was called Dermalife, Dermadeep. There were a combination with hyaluronic acid and polymethyl acrylate. They are still sold in the US market. So, if a new patient is coming, you should always ask where you got your injection. Not only when and which kind of injection. If you ask which kind of injection, 90% say I don't know. Most of the patients don't know what they have in their faces. Which is interesting. Which is very interesting. I don't know how it is in Lithuania, but in Germany, if you do a medical treatment, the patient, even for an appendectomy, they are telling you today how to do it. They say, but I need to do it minimally invasive. Yeah? And only with a 5mm camera, not more, not bigger. Yeah? And use, please, the stapler from the company, blah, blah, blah. Yeah? So they are well informed, but what they put in their face, you can put everything. If you are a good seller, you can inject what you want in the face. They don't care and they don't ask. So, where is my doctor? Also, hyaluronic acid. So, what is the hyaluronic acid? We don't need to talk about hyaluronic acid. We all know. Yeah? It's ubiquitous. What? It is biocompatible, but, yeah, non-immunogenic. or
Polisacharidinė,
non-allergenic,
nealergiška.
we cannot say this. Yeah? For there are some immune reactions where we don't know
Kadangi yra
why
tos reakcijos, kurių mes
and
nežinome,
how it works, but we know
kaip jos
that
veikia.
some
Bet kai
patients
kuriems pacientams tai
react to some triggers. Yeah?
yra tam tikri triggeriai.
And we know that the non-animal hyaluronic acid, as they are coming from a streptococcus, that we can have cross reactions to a streptococcal infection. So if you have a tonsillitis, if you have a sinusitis, if you have a tooth problem, yeah, you can have a cross reaction with filler. Why? For the streptococcus, the bacteria has a toxin, and the toxin is a foreign protein. And when you have an infection with the streptococcus, your streptococcus has his toxin, and so you can have a cross reaction. Yes, it is absorbable, it has a very high hydrating capability and it is a viscoelastic substance. Which side effects do we expect? So we have immediate side effects where we have a hematoma, some redness, some swelling, immediate type allergic reactions, I'm not sure. Pain, vascular complication, an immediate reaction, yeah, or an immediate problem. Yeah? But these immediate problems, the good thing is, we can treat them very well, or in many cases we just have to wait and to do nothing, they will disappear by themselves. So, the earlier a reaction comes up, the easier and earlier it disappears. The easier we can treat it, and the earlier it disappears. So then we have delayed 14 to 3 months, late reactions, very late, the granulomas. Yeah? The longer or the later the reaction appears, the more difficult it is to handle. And the more difficult we can treat them. Yeah? So, one thing about biofilm. There are these reactions after 3 months. Suddenly the patient wakes up with a redness, a swelling, yeah? No pain, nothing but a reaction. And then on the congresses now they tell us, oh, it is a biofilm reaction. Biofilm, everywhere is biofilm. I don't believe that hyaluronic acid reactions have a biofilm. There are the publication, the first publication about biofilm from Israel was a publication where they found biofilm-related bacterials after 3 weeks of incubation. 3 weeks. And they found bacteria in this publication. When you open a book of microbiology, you will never find this bacterium. So they are very, very rare. That's why I think it was a contamination from outside. But as we don't know what kind of reactions we have, some big names like Carruthers in Canada took this theory of biofilm and they brought it to the congresses. And since a few years, every of reaction, which are not immediately, which don't immediately disappear with a little bit of steroid, yeah, they say it is biofilm.
Ir tai nepašalinama nedidelio steroidų kiekio.
And then they tell you
Ir tada jie tau sako, jums sako,
that you need a triple antibiosis.
kad reikia
High dosage for a long term. But they never prove
bet
it.
jie niekada neįrodo to.
Yeah? So, if we
Thank you.
want to detect biofilm,
Jeigu mes norime
we have to
bijoti,
take a probe. we
turime
have
daryti
to do
punkciją, turime daryti
Immunohistology,
turime
and
imunohistologinę
even then we
funkciją
cannot find
atlikti.
it.
Ir netgi tada, jeigu mes negalime jos surasti,
But a biofilm needs a stable barrier.
bet
This we know from
biofilmų
implantology.
reikalauja stabilaus
Yeah.
barjero.
In general surgery, hip implants, yeah,
Ir bendrojoje
knee implants, they can have biofilms, for they have a stable barrier, yeah,
turi
where
būti
this
specialus
bacterium
stabilus barjeras.
can perform the biofilm. We know it from breast implants. There we
Mes
have,
žinome tai
of course, biofilms.
po krūties implantų ir kitų chirurginių operacijų.
But why should a substance like hyaluronic acid,
Bet kodėl medžiaga tokia kaip hialurono rūgštis,
which by itself is an antibacterial
kuri
substance,
savaime turi antibakterinių savybių,
which we are using in general surgery for chronic wounds,
kurias mes naudojame bendroje
where we
chirurgijoje,
have
išauginimo.
biofilms as well. Why should exactly this substance perform biofilms? I don't understand.
Kodėl mes turime
And I can tell you, in 15 years I'm dealing with side effects.
ir 15 metų, kaip aš dirbu su pašaliniais efektais,
If there was not a proved infection, where we found a relation to a proved infection, I never gave antibiotics.
ir kai aš netgi matydavau
Antibiotics
infekcijas,
only
aš
if
neskaitau
you
antibiotikų.
find a bacterium, a specific
Antibiotikas yra tik tai specifiniai bakterijų terpiai nugalėti.
Good. Some side effects are related
Kai
to
kurie pašaliniai efektai yra
medical
susiję.
treatments. They are related to the area. So we have more edema, initial edema on lips than anywhere else. Yeah. Pain as well. Lips, glabella area is more painful than any other areas which we inject.
Lūpų dalis yra pati skausmingiausia.
The same
nes mes
with,
injekuojame.
With erythema or with bruisings. It depends also on your technique.
Taip pat su
If you
mėlynėmis
are
ir
using
erytema
a
yra
very
priklauso nuo
traumatic
jūsų
technique,
technikos
you have more problems.
injekavimo.
Good. So, vascular complications are never related to a filler.
Vaskuliarinės komplikacijos niekad nėra susijusios su
A vascular
injekcija.
complication is an accident.
Vaskuliarinė komplikacija yra nelaimingas atsitikimas.
A vascular complication can always happen.
Vaskuliarinė komplikacija visada gali įvykti
everybody.
kiekvienam.
Good.
Gerai.
Lips.
Lūpos.
Those are edema.
Čia yra
Edema of a
edema.
lip next day after injection.
Dešimtą
Next day
dieną
after
po
injection.
injekcijos, kitą dieną po injekcijos.
This doesn't matter.
Tai nesvarbu.
Just wait.
Tiesiog laukite.
Or give a cream with a little bit of steroid one
Arba
time.
duokite
And
kremo su truputėliu
it's
steroidų.
this is an unspecific reaction.
Yra nespecifinė reakcija.
Unspecific means this lady came 6 weeks after injection of the cheekbone,
Savaitės po injekcijos.
and she had this swelling in the forehead and around the eyes.
Patyrusi kakta.
We didn't know what it was.
Mes nežinojom, kas tai buvo.
We gave a steroid treatment.
Davėme gydymą steroidais
It disappeared after 2 days.
ir po 2 dienų laikotarpio,
A few days later, after you stopped with steroids, it came back.
kai tik nutraukėm steroidus,
The doctor treated with
pradinę.
antibiotics. Nothing happened.
Again,
Against steroids,
it
it disappeared. And this was recurrent, 2-3
Tai buvo
times.
rekurentinė 2-3 kartus.
Nobody knew what happened really.
Niekas nežino, kas iš tikrųjų įvyko.
It disappeared forever and we don't know why.
Yra bėda visą
Unspecific
laiku ir mes nežinom dėl ko.
immunologic reaction. This case is different.
Šitas atvejis yra skirtingas.
This started also after the injection of the cheekbone.
Čia yra prasidėjo po injekcijos.
4 weeks later, the lady came back to her doctor
Praėjus 4 savaitėm ledė atvyko
with a swelling and an inflammatory reaction.
Kur antiinflamatorinė priešuždegiminė reakcija.
The doctor gave her hyaluronic. So he dissolved the hyaluronic acid.
Gydytojas jai paskyrė hialuronidazę, kuris suskaido.
The reaction disappeared.
Reakcija pasitraukė.
The patient came back after 5 days
Pacientė išvyko po 5 dienų,
and she told her doctor that now I am asymmetric.
sakydama daktarė, aš dabar esu asimetriška.
What has the doctor done?
Ką padarė daktaras?
He injected again.
Jis injekavo vėl.
4 weeks later,
Po 4 savaičių
the patient came back
pacientė grįžo vėl.
like this.
Tokia.
The doctor, what has he done?
Ką
He
žinai,
thought,
ką gydytojas?
last time hyaluronic worked very good, so he gave her hyaluronidase again.
Vėl jis suleido hialurono rūgšties.
And the patient, what did the patient? A few days later, she came back again. And she said, but now I am asymmetric.
Bet atėjo sako, aš dabar esu asimetriška.
So what has the doctor done?
Ką padarė gydytojas?
He injected again.
Injekavo.
And 4 weeks later, the patient came back again.
Pacientė grįžo vėl.
Like this.
Kaip tokia.
And the doctor,
Ir daktaras pasakė,
incredible 4 times. So, injection, dissolving, injection, dissolving, injection, dissolving, injecting. And then she stopped.
ir tada jis
Finally.
sustojo.
She went to another doctor.
Ji nuėjo pas kitą gydytoją.
And the other doctor
Kitas gydytojas
started to give her first low dose
pradėjo
steroids.
skirti pirmosius žemosios mažų dozių steroidus.
So, 2-3 days,
2-3
boop,
dienos
the effect disappeared.
efektas pasibaigė,
She was fine.
ji buvo gerai.
4 weeks later,
Praėjus 4
she
savaitėms,
came back again.
jie atėjo vėl.
The doctor gave her again 2-3 days steroids.
Gydytojas jai vėl davė 2-3 dienos
It
steroidų.
disappeared.
Problema
And after 4 weeks later,
po savaičių,
she came back
ji
again.
vėl atėjo.
So the doctor said, sorry, I don't know what to do.
Daktaras sakė, atsiprašau, aš nežinau ką daryti.
He tried again hyaluronic.
Jis
But
pagalvojo hialuronidazę.
it doesn't matter anyway. 4-5 weeks later, she came again, even after hyaluronic.
Vėl jinai atėjo.
So the doctor said, I
Daktaras
don't
sako,
know.
aš nežinau ką daryti.
Then she went to the next doctor.
Tai jį perėjo pas trečią daktarą.
This was a biofilm guy.
Tas buvo biofilmo.
And the biofilm doctor gave her 3 months.
Biofilmo daktaras jai 3 mėnesius.
Triple antibiotics,
Trigubus antibiotikus,
full dosage.
pilną dozę.
2 of the 3
2 iš 3
were the same generation of cephalosporin.
buvo tos pačios kartos.
For just to give
cephalosporinai.
3 different names.
3 skirtingi pavadinimai.
Yeah? Not knowing what he is doing.
Net nežinodami, ką jie daro.
No, they are doctors. Huh?
Jie yra
They
gydytojai.
have a license
Jie turi
still.
licencijas.
So if we would do such
Tai
procedures
jeigu mes atliksime
with
tokias
a normal
procedūras,
patient,
kiekvienam
they would
pacientui,
take our license.
tai mes neteksime licencijos.
But in aesthetic medicine, you can do what you want.
Bet esi
So don't worry.
gali daryti ką nori, taigi gali nesijaudinti.
After 3 months, they stopped the antibiotics
Po 3 mėnesių jie nutraukė antibiotikus
And 4 or 5 weeks later, she came back.
Ir po 4-5 savaičių jie atėjo vėl.
So she changed again the doctor.
Ir jį pakeitė vėl, jau 4 daktarą.
The last doctor,
Paskutinis daktaras,
of course, when he heard,
kai jisai girdėjo,
the steroid treatment was good for you,
steroidų gydymas buvo
he
geresnis.
started again with
Jis
steroids.
pradėjo vėl steroidinį gydymą.
It went down. When he stopped steroid, it came back.
Bet kai sustabdė steroidus, jie vėl
So this doctor decided,
Šitas daktaras
we continue with steroids.
tęsti su steroidais.
And after a few weeks,
Ir po kelių savaičių
a steroid treatment,
steroidinio gydymo,
she came to me
jie atėjo pas mane
with the Cushing syndrome.
su Cushing'o sindromu.
So the last doctor
Paskutinis
gave
daktaras,
her really a good treatment with steroids.
jai davė gerą gydymą steroidais.
So first we had to treat the Cushing's, we had to reduce the steroid
Mes turime sumažinti
dosage.
Cushing'o sindromą. Steroidai.
What happened, of course, after we stopped,
Po to, kai mes
a
baigėme
few weeks later she appeared again with the inflammatory reaction.
Po kelių savaičių jie atėjo vėl su uždegiminiais sutrikimais.
At the moment, I was not really surprised on one side here that it is not only a hematoma.
Ir aišku, nėra tik vien tik hematoma.
This is after a few days. Yeah, this is at the end. After a few days, it starts to have this incrustation. It's typical. And it starts like small spots.
Ir jie ši sužalojimai prasideda kaip
And then you get this photo. And what is the question? When they sent me this photo, the question is, and now my patient has herpes, what shall I do?
Klausimas, dabar mano pacientas turi herpes, ką man daryti? Famciklovir.
And then my question is,
Ir tada mano klausimas yra,
which dermatoma is this for a herpes? Which dermatoma is this? There doesn't exist a hematoma, a dermatoma in this area where you perform a herpes in this way.
kai herpes beria šitokių.
So it's basic sometimes, basic. This is a superficial necrosis.
Tai yra paviršinė nekrozė.
And it looks always the same.
Ir jie atrodo visada taip pat.
And it is always the wrong diagnosis from doctors, and now they have herpes.
Kad jie dabar turi herpes.
Here again, libido of the forehead. Libido. A few days later, superficial necrosis.
Can we ask about previous picture about herpes? This dėl šito.
No, it is not herpes. It's a necrosis.
Čia yra nekrozė.
Hyaluronic acid filler. A filler in the glabella. Glabella injection, self-injected by the doctor. Glabella injection. The same here.
Panašiai čia.
Forehead lines injection.
Kaktos injekcijos.
Same, after a few days.
Po kelių dienų.
Here, first photo, it was not clear, of course. It looks like a hematoma. It looks like a hematoma. But 3 days later, you have this formation, and then it was clear that it was not a hematoma. The thing is, you always, when you enter a vessel, you always have also a hematoma. And just to tell you, this is the result with a 25 gauge cannula. This is a necrosis with a 25 gauge cannula. So this is the end, but here is too late. If you have these cases, it is too late. Good. What are the reasons of a doctor? Inadequate medical talk. This we were talking before. Ignorance of anatomy, of course.
Anatomijos neišmanymas ir anatominių pakitimų neišmanymas, klaidingos indikacijos, klaidingas medžiagų.
A wrong indication.
Higienos ir profesionalumo.
When they are injecting, for example, dark eye circles where there is no valley. And then they have an overcorrection, they have swelling Tyndall effect, yeah? So the wrong material. Wrong material selection as well, yeah? When you are using a very dense, a volumizing product for lips, for example. When you are using a volumizing product and you inject necklines. Yeah? So, wrong material. Lack of hygiene. Professional appearance. It's getting better the last years on the congresses and on the workshops. But normally, they inject on a workshop with the tie, which is in the face, yeah? They perform sterile gloves, but in between they are doing like, I don't know why. So the typical mistake which we can see in emergency rooms with young doctors, they have sterile gloves, the patient is coming, they touch the wound with sterile gloves, and then they take their non-sterile, not anymore sterile gloves, and they open the box to take out sterile compress, yeah? So I prefer to do the performance without sterile gloves, for then you know that your gloves are not sterile, and then you are not on the way to touch the cannula. Yeah? So never touch cannula with your gloves. Yeah? Lack of hygiene. The most important thing on a workshop or on a congress is that you can see the Rolex of the injector. Yeah? And when it is a lady, all their diamonds and rings they have from their lovely husbands, and not only husbands, doesn't matter, everything, and the necklace and the hair, yeah. So I have never seen so many hygienic mistakes as in aesthetic medicine. Wrong injection technique, torero, boom, 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 yeah. Over treatment, and of course, sometimes the overestimation of the capabilities. About anatomy we were talking. Wrong indication. Noses. So on a nose we have to respect some angles. Yeah? We cannot just inject the nose to make it straight. If we fill up a nose from the forehead to the tip, yeah, just to correct the hump, it might correct the hump, but it looks ugly. Yeah? So in this case, an Asian nose, she was injected 2 years before. 2 years before. She had a very wide, and you see it's an ugly epicanthus, yeah? It's too wide. When we look lateral, it's almost straight. But even 2 years later, 10 minutes after hyaluronidase, you see that the nose was longer, elongated, and that we get a little bit better the curve. Yeah? So, only 10 minutes after, 2 years
Ir
later,
net po 2 metų.
so hyaluronidase is working even after a long time.
Hialuronidazė veikia net po ilgo laiko.
Wrong filler, a volumizing filler for teardrop,
Longas
makes
užpildymas.
lumps, of course. Yeah? A wrong filler on the necklines.
Blogas užpildymas.
Cross-linked hyaluronic
zonoje.
acid on the necklines make typical Tyndall effect and overcorrection.
Tipinį Tyndalio efektą.
When you inject, you don't see it.
Kai jūs injekuojate, jūs
But
nematote
once
jo.
the neck comes back, she has this collar, this triple collar,
Tas
and
matote,
to
tai- tai
dissolve this, yeah, to dissolve this, you need much more time than
Norint
to
tai palaikyti,
inject.
reikia daug daugiau laiko.
This patient needed 6 sessions until
Šiam
we could
pacientui
solve
reikėjo
the
6
problem.
sesijų.
And for the hyalas, was not able to do it in one session. Yeah.
Hialuronidazė nepavyko atlikti per vieną sesiją.
Lack of hygiene. This is an abscess. This is an abscess with a necrosis. For the doctor thought it is just a reaction, allergic reaction. And he was waiting too long, you see. This abscess makes a necrosis. This is another special case. 3 days after injection.
3 dienos po injekcijos.
3 days after injection, the doctor sent me on WhatsApp this picture.
Gydytojas atsiuntė šią nuotrauką.
And he's asking how many hyalas I recommend.
Ką aš rekomenduočiau?
The patient was injected 3 days before,
Pacientui buvo injekcija atlikta
and
3
the
dienas.
swelling is increasing every day.
Ir patinimas auga kiekvieną dieną.
How can I treat this granuloma?
Kaip man pagydyti šią granulomą?
A granuloma
Granuloma.
growing in 3 days.
Auga per 3 dienas.
It's impossible.
Neįmanoma.
First, to talk about granuloma. A granuloma is
Pirma,
a
kalbant
late
apie granulomą,
reaction.
Yra vėlyva reakcija.
Earliest half a year after injection.
Mažiausiai pusę metų po injekcijos.
So it's impossible that it is a granuloma.
Taigi neįmanoma, kad tai būtų granuloma.
It is growing fast.
Jinai auga greitai.
It hurts.
Jis skauda.
Every day bigger.
Kiekvieną dieną vis didesnė.
What is your
Kokia
recommendation?
jūsų rekomendacija?
What? Sure. How much hyalas would you use?
Kiek hialuronidazės jūs naudotumėte?
Would you use
Ar jūs
hyaluronidase?
naudotumėte?
No.
Ne.
Why?
Kodėl?
No, this is always the same. Huh?
Because this infection is
Is an infection.
destructive.
Kad tai yra infekcija.
But what would you do now?
Ką jūs darytumėte tada?
Now you must be careful.
Dabar jūs turite būti atsargi.
Yes.
Now you must be careful.
Dabar jūs turite būti labai atsargi.
Basic medicine.
Bazinė medicina.
I only say basic
Aš irgi sakau
medicine.
bazinė medicina.
500 years
500 metų
after Theophrastus Bombastus from
Theophrastus.
Hohenheim, well known as Paracelsus,
gerai žinomas Paracelsas.
there is only one treatment for
Yra
this.
tik vienas gydymas tam.
And 500 years ago,
Ir prieš 500
we had no antibiotics.
nebuvo antibiotikų.
You didn't want to give her antibiotics. Right? You didn't want to give her antibiotics. So, what are we doing? Ubi pus ibi evacua. It is an abscess. This is an abscess. Infection, right. But it is an abscess. Yeah? Growing fast, painful. Making, look, making formation like here where you even can see how the pus is coming out, yeah? So it's an abscess.
Taigi tai yra abscesas.
Cut! Pick!
Pradurkite ir
You
išsišnekėkite.
take a scalpel
paimkite skalpelį,
and you make a small cut.
padarote mažą
Inner
išėjimą.
side of the lip, this was a photo next day.
Ir štai
No
po
antibiotics.
to po kitą dieną
Just-
be antibiotikų.
If you give an antibiotics, what will happen? Nothing.
Jeigu
Nothing.
skirsi antibiotikų, nieko
On an
nepasikeis.
abscess, every abscess has a capsule, the antibiotics
Kiekvienas
is not
abscesas
working.
turi kapsulę, kuri apsaugo
So,
antibiotikų.
next day, and she looked fine.
Taigi tik tai bakstelikite skalpelį ir kitą dieną
Here.
daug geriau.
Wrong technique, wrong filler. So, the wrong filler was injected on the wrong place to correct the tear trough.
Neakvota neteisingoje vietoje.
Next lady, 2 years, swelling of this swelling under the eyes, the bananas. Yeah? Typical bananas under
Bananinės
the
akys.
eyes.
Tipiškas
2 years
bananimas.
before.
Prieš dvejus
She went
metus
to several doctors. Everybody
Yeah,
said, we
but
cannot do anything for you.
ir jie pasakė, jie nieko negali padaryti.
10 minutes after Hayalas and the next day.
10 minučių po hidro.
This poor lady was 2 years destroyed.
Ir 2 metai buvo praleisti.
And this is a very interesting case.
Ir čia labai įdomus atvejis.
It was a speaker
Tai buvo kalbėtoja.
on a workshop. Unfortunately, I don't have the picture before. This is the picture after.
Foto prieš tai. Jau yra foto po.
But you can probably imagine how this lady looked like before.
Jūs galite įsivaizduoti,
Similar
kaip
as
atrodė
this
po.
lady I showed you in the anatomy lecture with the landmarks. Yeah, so she was really skinny like this. Yeah. So on a workshop, the doctor started with cannula here and here.
Pradėjome su kaneliu dviejose vietose.
Superficial. So
Paviršinė.
first correction was nasolabial fold,
Pirmoji korekcija buvo
marionette lines, and then he tried to correct all this area, for it was with a lot of wrinkles.
visą šią.
She had elastosis of the skin, and she was like this, and she injected.
Ir jį injekavo.
I remember very well, it was ultra deep from Teoxan, so the strongest volumizer on the market at this time.
Stipriausia tuo metu esanti rinkoje medžiaga.
And he injected 1 ml, he injected 2 ml,
Jis injekavo 1 mililitrą, 2 mililitrus.
4 ml, 8
8
ml,
mililitrus,
12
12
ml.
mililitrų.
So he injected 14
Jis injekavo
ml each side, each side.
Ir kiekviena pusė
Oh, good result, fantastic, huh?
geras.
The patient at the first moment was very happy.
Pacientė pradžioje buvo labai laiminga.
The only thing is that she couldn't move anymore her lips.
Tik tai, kad tai negalėjo daugiau
And when you entered with your finger, all this area, all this, what you can see, up to down and here, it was really big like this, yeah?
buvo išsipūtę.
All this area was like a stone. It was like a stone. Buck, 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 buck. Yeah? So,
Taigi,
be careful, huh?
būkite atsargus.
Good. So, if something happens,
Jeigu kas nors atsitinka,
or before something happens,
ir prieš
you
kas nors
should
atsitinka,
take some notes about the
turite
situation
pasižymėti
of
apie
your patient.
situaciją.
Anamnesis.
Anamnezė.
You should give an information to your patient so
Jūs
that
turite
the patient
informaciją
knows
pacientui, kad
what
pacientas
can
žinotų,
happen.
Kas gali įvykti.
And there, I can only recommend you, you should tell your patient also about blindness.
Ir jūs taip pat turite
There
įspėti
are
pacientą
cases
dėl
of
akumo.
blindness after lip injections. There are cases of blindness after chin injections.
Yra atveju akumo dėl
So,
lūpų injekcijos arba
You should always tell your patient and talk about the worst case that can happen.
Jūs
Even if it is very rare. We all know when we are driving a car that we can die. We all know it. But anyway, we go on the street every day without thinking about it. Yeah. I think the risk to die by car is higher than to get blind with an injectable, but they have to know. Then you have to make a documentation where you inject how many of your product. For if something happens after a few weeks, you don't know where you inject. You know where you injected, but you don't know anymore how much. So you should give your patient a beauty pass. So that you also, and not only you, even the patient knows which product is inside, but where you can put the batch number inside so that the patient also has a control of his product. And then every company has a so-called complication sheet which you have to fill out in case of a complication. So, protocols. The protocols I put here are not evidence-based. The only evidence is that I am using them since more than 10 years. So if you have a vascular complication, give Hyalas as much as you can and as you have in your office. Hyalas, a fairy tale. Hyalas does nothing to the soft tissue. There are so many stupid talks in internet, bloggers, blah, blah, blah. Oh, never Hyalas, Hyalas, Hyalas. No. Hyalas we are using for around 40, 50 years in ophthalmology. It is a spreading factor, nothing else. It is a spreading factor that we use less local anesthesia in ophthalmology. We are using it in local anesthesia for surgery. For example, for hernia surgery. We are using Hyalas as a spreading factor, not to use as much of lidocaine. Yeah? So, of course, Hyalas also degrades our own hyaluronic acid. But the normal hyaluronic acid in the skin will be restored within 5 days. Yeah. So don't worry, it's all stupid things that we are reading. So depending how big is the libido which you can see immediately, you can do Hyalas every hour or twice a day. In my experience, I can tell you twice a day is enough. Yeah. The US recommendation is every hour. Why? For they say the half time of Hyalas is half an hour. Yeah, so after 1 hour you have no reaction anymore of Hyalas, so you have to redo it. Yeah. The problem is if you give too often Hyalas, so every hour, you have to dilute the Hyalas. So you inject a lot of volume in a soft tissue which has a malperfusion. So you can probably compress the capillaries, not the big vessels, but the capillaries. So you have a problem. Yeah? So I do it normally twice a day. Then, of course, you have to start monitor the patient, which is easy for every patient has a smartphone, so you tell them, you send me tomorrow morning a new picture, yeah? And if the picture is fine, they can send you a next picture at lunchtime, in the evening, and then you decide if you have to redo the procedure without seeing the patient. Yeah? Cannula is better than needle. Why? For we have to put the hyaluronidase everywhere where the libido is. Not only where we inject it. A compression of an artery does not exist. It is always an embolization. So the hyaluronic acid is in the last capillaries. So we have to open the capillaries, not the big vessel. Yeah? That's why we have to put the hyalas everywhere where the libido is. And the best thing is with a cannula. If you are using a needle and you inject 20 times in this area, you will have bruising. And at the end, you will not see the difference in between libido and bruising. All area of libido. Warm compresses. Aspirin. Nitro paste. If you have a big vascular complication, even pentoxifylline intravenous, it's not approved, but just give it to open the doors. Sildenafil, Viagra, to open it. Yeah? If it is late, so if you have a vascular complication, the patient is coming after 3 days, and you already see these incrustations, which are not herpes, which are a superficial necrosis, then of course you have to give antibiotics, for the barrier of the skin is damaged. And I recommend high dosage of prednisolone to reduce the swelling. And if it is really a late appearance of the patient, so if the patient is coming really with a damage of the skin that you see that it is really necrotic, yeah, and you cannot work anymore with hyalas, or the hyalas is not working as you think, send them as fast as possible to a hyperbaric chamber. Every day, 45 minutes for 8 to 10 days. Yeah? It's very expensive, but it's the only thing which can help. Good. If we have, you remember the unspecific inflammatory reaction. Step 1, what I'm doing is that I take blood and I'm searching for an antistreptolysin titer. If the titer is high, we have to search for a focus. And then of course we have to give or antibiotics or do some operation. Step 2, which is also related to step 1, for the patient is coming and they want something from you, I always start with antihistamines. Just to do something. It's more a psychological thing, yeah, until I get the result of my blood test. Yeah? But I can tell you, 80–85% of patients after antihistamine is done. So in most cases, so there must be something related, trigger, which reacts also to antihistamine, yeah? For mainly after 1–2 days with antihistamines, most of those unspecific reactions disappear. If we cannot find a focus, if we have no reaction to antihistamines, next step, prednisolone. I don't combine all what I can find in my practice in one time. For at the end you don't know which was working. Yeah.
Aš
So
niekada-
mainly the doctors, when they have a complication,
Paprastai
in
dažnai, kai jie
aesthetic,
turi komplikacijas,
they try with a polypragmasia to take everything they can find in the office.
jie bando imti viską, ką jie randa.
I had one of my colleagues,
Aš turiu vieną iš
she
mano
had a
kolegų.
vascular complication and she got so crazy. She took everything what she found for the vascular complication, everything in her office, yeah, just to treat it. Yeah? So, prednisolone, like a protocol. And if prednisolone is not
Ir
working,
jeigu prednizolas,
Last
tai reikia
step,
paskutinis yra
colchicine.
kolchicinas. Kolchicino turnalė, rudeninis
with
dalykas.
this, I never can remember that we had a patient which was not fine with
Ir aš
this
neatsimenu
treatment.
vieno paciento, kuris gal gale nebūdavo
So,
užtenka su...
Antibiotics, I told you, I don't believe in biofilm, that's why I don't recommend antibiotics, only in cases when we find something. Yeah.
Tik tuo atveju, jeigu mes
If we
matome
have a
kažkokią
focus,
infekciją.
of course, antibiotics. If we don't have an evidence that there is an infection,
Jeigu mes
no
neturime
antibiotics.
įrodymų, kad tai yra infekcija, tai mes turime...
So, this is a protocol. It's not necessary for a short-term prednisolone treatment of 1 week. You don't need to have a
Mums
protocol.
nereikia tokio detalaus, jeigu gydysime trumpai prie
But if you give this protocol to your patient, they think, oh, my doctor, he knows what he's doing.
Bet jeigu jūs
Yeah.
duodate tokį
If I
protokolą
give them
pacientui,
only
jisai
one
sako, "O,
tablet
man
every
kažką
day,
darė."
100 milligram, ba, yeah, for 3-4 days, but just give me a tablet. No, I give you a treatment, yeah. I start with 100 or 50 milligram, you have to start high. I always see when there are such reactions,
Mes visada
especially in
matome,
dermatologists, they start with 4 milligrams.
Mes pradedame nuo miligramų.
What is 4 milligrams?
Tai yra 4
Nothing.
miligramai.
It is probably for a skin disease is nice, yeah, but for a reaction, 4 milligram is nothing.
per mažai.
So, I give this protocol. Don't forget to give them pantoprazole or omeprazole
Nepamirškite jiem
for
paskirti
the stomach.
omeprazolio arba pantoprazolio, kad ne...
The worst case which could happen. Good. If it is not working, colchicine.
Jeigu tai neveikia, tada
Colchicine 2 times a day. First day, 2 milligrams, morning, evening. Day 2 to 3, 2 milligrams in the evening. And then, if it's not going away, but mainly, I never had a case where the colchicine was or had to be given longer than 4 or 5 days.
Ir aš niekada nesusidariau su atveju, kada kolchicinas turėjo būti skiriamas
But you
daugiau negu
can
14 dienom.
continue with colchicine up to 3 months with
Bet jūs
1
galite
milligram.
tęsti tą kolchiciną 4 kartus.
The side effect with diarrhea happens with a high dosage. But if patients take colchicine, you have to be careful. They shouldn't have a contraindication or they shouldn't have a cardiac medication. For the plasma uptake of those medicines is disturbed by colchicine. And they can really get in a big trouble. So on young patients, nothing will happen anyway. But if you have older patients, be careful with colchicine. And if it is contraindicated or not available, you can also give a long-term treatment with allopurinol.
Tada skirkite ilgą gydymą
The allopurinol treatment, there are many publications from the end of 19th,
Yra daug publikacijų,
which were done by Qmate Restylane, yeah. So they published this treatment with late inflammatory reactions where you can give a long-term
galima taikyti ilgalaikį allopurinolį
So,
gydymą.
if we have
Jeigu mes turime
a complication, then we have to
Plastic
watch.
surgery, we give volume and the projection comes up. And the projection. Today somebody told me this stage is safe, not for me.
So, what I wanted to tell you, it is an accident. An accident always can happen.
Tai yra
But
avarija, kuri gali visada įvykti.
if you have a complication, as me, I slipped out, I stand up and I continue my work. So, this is the main message. If you have a complication, even if they are in aesthetics and they pay for it, money, yeah, don't close your eyes and say, yeah, I hope it will not be as bad. Yeah, don't close your eyes.
Neužmerkite akių.
Start to face the complication and start to treat your patient.
Kovoti su komplikacija.
So we have to learn that a complication is an accident. Yeah? In surgery it is normal. If we have a bleeding, we have to stop it. Yeah? But if you have in aesthetics a problem, yeah,
Jeigu jūs turite estetinę
don't
problemą,
worry. The patient will honor when you start to
nebijokite,
keep
pacientas visada
professional and not to
gerbs
lose your head
profesionaliai.
or to start to tell stupid things. No, it's nothing. Wait, it will go away. Wait, nothing. No. Take it and start, if it is necessary, start to do something.
Jeigu reikia, jūs
Thank you very
užsikūrė
much.
paveikti.